Hello and welcome to tonight's broadcast. I am Patricia Rogers here at CSR News. I'd like to start off by saying thank you for joining us tonight. Now, for tonight's broadcast, I wanted to get into depth a bit about the disparities that we have in this country, relatively about what can cause this to happen and why these situations are still going on that affects the lives of others. In our discussion, basing it on the seriousness of health disparities that Americans face, tonight's discussion is going to hopefully enlighten our listeners about the severity of how lack of education is becoming one of the main causes for disparities. Now, many in our country struggle and face hardships in their lives in regards to social classes, race and ethnicity, amount of income, and environmental living standards, and so on, to which many of our fellow Americans encounter this obstacle as another level of inequality. But before we get down to the main part of this discussion, it is important to go over to the terms that we will be using throughout this broadcast: disparity and health and disparity, to which the dictionary website definition of disparity is the lack of similarity or equality, meaning to have a basis of inequality. The other term, health disparity, reports from the CDC describe this term as preventable differences of disease, injury, or opportunities to achieve optimum health that are experienced by social disadvantaged populations. There are multiple factors that relate towards health disparities, such as unequal distribution of social, political, economic, and environmental resources. However, another cause towards this outcome falls into the lack of education that could affect many of our Americans who are part of this population in the states that do not have as much access to education rather than others. Some out there may be wondering if there is a significance in disparities and why should this be addressed. Now, to put into a perspective that can be helpful for others to understand about how important this topic is, disparity dwell on the premise that there is level of inequality in our system of health. As a country that is based on a policy of how we as a country are equal and should be equal, health disparities in this case show a false pretense of our country's policy. Now, in the article website from the Kaiser Family Foundations had this to say about how disparities matter. Disparities in health not only affect communities facing these kinds of situations, but they also limit overall achievement in the quality of care and the health for a broader population and lead towards unnecessary expenditures. Managing health disparities is substantially important as the population develops and becomes more diverse. It is projected that people of color will account for over half of the population in 2050, roughly 52%. Education is the absolute foundation in how we manage our lives. It is based on how we see, view the world, but also as how we handle our health, income, our homes, and our families. It is also understanding of what we eat, what we drink, what is good for our bodies, and what is not, like harmful chemicals. Without education or a form of knowledge, how can we determine if what we consume is good for us? Or what we put into our bodies, will it have a drastic effect? Or will it be beneficial? Such as smoking cigarettes, because how can we know if cigarettes are bad for us without education, without research, without so on? Education is always going to be the backbone for social class, for working class, to the upper classes. Education enhances more opportunities for better career paths for people. Education, as it pertains to health management, is a system of processes, and to which of those processes form outcomes. In the article, Annual Review of Public Health, they claim that the process of education attainment depends on the amount of resources such as family teachings, years of schooling, community-based programs, is the process in which young adults or young children obtain information, whereas with the outcome is the amount of skills and capabilities of the sum of knowledge that they have obtained, and then that could influence the determinants of health. Another quote that I'd like to pull is from the authors of Communities in Action, Pathways to Health Equality, mention how the education gradient in health outcomes for the United States has varied throughout the last 4 decades. over that period of time has caused a large gap in health status between Americans with high education versus Americans with lower levels of education. So, with that being said, my question is, why is that? How come within the last 4 decades has the gap grown more and more between Americans with lower education versus people with higher education? Why is that gap increasing? Why is the gap increasing? I'm sorry. What could cause this? Advancements in technology or healthcare? What could it be? They also stated that throughout some of the programs of K-12 through grade school in the United States, between the years of 2000 and 2013, the rate of students who came from low-income households, mostly African American and Hispanic communities, the rating percentage grew from 9% to 16% within those 13 years. And at these specific schools, 75 to 100% of their population of students were from these communities of African Americans and Hispanics. Within these schools, unlike the standardization of regulations in other schools throughout the country, they only offered disproportionate teachings in certain regards to math and sciences and college preparatory courses. So again, why is that? What are those numbers saying? What could this be telling us? Since the 1980s in the United States, educational programs are guided and mandated through the states individually in each country. We found a website from the American School and University released the ratings of the lowest educated schools in America. After running an analysis on the beginning of 2020, they included the top 10 states with the lowest ratings in education. These states included Mississippi, West Virginia, Louisiana, Arkansas, Alabama, Kentucky, South Carolina, Nevada, New Mexico, and Tennessee. Out of those 10 states rating in the lowest resorts in the Department of Education, we took a look into the statistics from the CDC with the states who held the most chronic illnesses. The data collected was a sample back in 2014 to determine how many populations carry multiple chronic conditions, MCC. One thing I like to point out is that the surveys were distinguished between age and sex. So this was a report through the CDC, and like I said, the survey's results were distinguished between age and sex. Now, here are the results. From the CDC, they reported the top 10 states that had the most people who had chronic conditions. And I'm not talking about one chronic condition, I'm talking about multiple chronic conditions. So here's the top 10. Kentucky's MCC was reported that they had 38.2% of people. Alabama was 35.8%. West Virginia was 34.6%. Mississippi, 34.2%. Montana was 33.2%. New Mexico, 32.9%. Maine was 30.9%. Michigan was 30.3%. Ohio was 29.6%. And Pennsylvania was 29.6%. Now, these ratings were back in 2016, but now, before I get into the nitty-gritty, I just wanted to ask and wonder if you guys can see a pattern between these two results. Taking the two results of states with the lowest outcomes in education, as well as the results from the CDC of the top 10 states in the United States that have multiple chronic conditions in their populations, or their populations resulting or having multiple chronic conditions, like Kentucky, Mississippi, Alabama, West Virginia, and New Mexico. Now, can you see a pattern? Out of those 5 states, showed up on both results. So that means that Kentucky, Mississippi, Alabama, Virginia, West Virginia, and New Mexico have multiple chronic conditions in their populations, but they also they are part of the lower educational bracket in our country out of 50 states. Now, that's astonishing statistic to say. So that should mean something. That means that education in itself is a disparity. That could, necessarily mean. Because how come that's 5 states out of each 10, because there was 10 states in the lower educational bracket, and there were 10 states with the multiple chronic conditions. That was all states were in half. Like that was about 5. So what does that mean? These are the questions that we should be asking. Also, too, this should be a statistical result as to why health disparities in education needs to be fixed. So, with that being said, we are going to take a quick break, and when we come back, we're going to have a guest come and talk with us about the disparities